All right, so I know we just raced through a lot of information in 20 minutes, and there's probably a lot here to digest. So I am going to open the floor for any questions you might have at this time. Feel free to enter your questions into chat or unmute yourself, and you can go ahead and unmute yourself and ask your question. Or if you feel more comfortable being called on, you're welcome to raise your hand. You can either do so on your camera, or you can do so through the Zoom interface. It looks like we do have one item in chat. Oh, and that was Christina saying you can post your questions here. So I'm going to go ahead and stop sharing so we can see faces, but I'm more than happy to pull these slides up again at any point if we need to look at any slide in particular. All right, so I'm going to go ahead and open the floor for questions.
This is Stephanie. While we're waiting for people to come up with their questions, Amelia, maybe you can talk about how this kind of builds on the successful pilot program done in Clearwater County with funding from the Blue Cross of Idaho Foundation for Health, because I think it's important if people don't know about that they've been able to utilize funds and have programs up and running. They're scheduling telehealth visits and appointments and no major problems, and the expectations are that this is really going to be, just a pilot, and we're not expecting, great volumes of appointments and some of those things too. Can you talk a little bit about that?
Well, sure, Stephanie, although I feel like you covered it pretty well. Yeah, so just for those folks who are interested in applying, this is actually the second round of funding that we've received from Blue Cross Foundation for Health. The first round of funding was sort of a silent project where we kind of reached out specifically to a couple of libraries to do sort of a very early adoption of these of telehealth services in libraries. And so that was the two library systems in Clearwater County. So we had Clearwater Memorial in Orofino, and we had the Clearwater District Library in Weippe. And both of those libraries I think they received $10,000 as just sort of a money to sort of see what we could do. And they both set up, I think, semi-private spaces. One of them had there was a semi-private space in one, and then there was an existing private room in another library that they converted. And so a great example of how construction costs could be covered with this grant is that in that library there was a window between the private room and the rest of the building, and that was single pane glass. And so it allowed sound to come and go, which wasn't great for privacy purposes when you're having a health related conversation. So they used funding from this grant to replace those windows with double pane glass and do some other upgrades to that room to really allow it to be suitable for telehealth purposes. And I think we can definitely dive into more about their experiences, but it does look like we have a couple of questions. So I'm going to make sure that we answer those. So Lori asked, with the privacy pods become available, would that be part of the money we're asking for, or would it be separate? So that is a separate opportunity. You could certainly use this grant to purchase and install a privacy pod. That's definitely a qualifying project and expense. With the project with health and welfare, what we're expecting that will look like is that the purchasing and logistics of that will probably go through either health and welfare or the commission in partnership with the library. So we wouldn't be granting money out to the libraries with that one. We would actually be, I think, it's still a little fuzzy, but the end result is that the library would have a privacy pod on site that would be fully paid for. But that is a separate funding opportunity. If you were to apply for this grant and receive money here and you wanted to throw your name in the hat for a second privacy pod, you can certainly do that. I haven't solidified kind of the plans and the restrictions for that opportunity yet. Rebecca asked or mentioned there's a webinar from Info People that offers examples of models and other libraries for sharing that. Derek asked, my library is in Boise, so doesn't qualify under the criteria. However, I believe there is still a need in the community that we serve. We already have study rooms at this branch with tech and internet, so I'm interested in exploring this model without any grant funding. Can we reach out to Blue Cross Foundation to see about a possible partnership? I mean, I can talk to Stephanie about that. We can, kind of feel that out. You're also welcome to, if you want to explore telehealth and you're not asking for funding through this project, let me know. We can certainly include you in the cohort model, even if you're not funded, but you are having an ongoing project where you could really benefit from that technical assistance and that cohort support. We'd be more than happy to loop you in on that as well. All right, Haley Public Library asked, can you talk about what the requirements would look like for showing that funds are committed for construction if we cannot complete it before the December deadline? That is a great question. And with the world being as it is, with delays in supply chain issues and costs just not being predictable from one to the next, I understand that construction, while it's great that we can fund construction, it might be a little bit challenging. So I think because we're working with Blue Cross, they have significantly more flexibility than if we were looking at federal funding. So if you put together a great proposal that has a really strong outcome and we're really excited about it, if there are delays with construction, we just need to keep in contact with each other, be on top of it, and be open with our communication about it. And we can certainly reach out to Blue Cross to talk about extending that funding. I do think that having all the paperwork with your construction, like the quote, any deposits that you've made, any guarantees or contracts that you've signed with the construction company will be really important when considering whether to grant you an extension for funding, because that will show that things are moving along. It's a great question. All right, lots of good links being shared in the chat as well. I will try to capture that and hopefully we can post some of those links alongside the recording of this video as well. Right, any other questions? Big questions, small questions? There's no question, no silly questions. So even if you think it might be a silly question, I encourage you to speak up or enter it into the chat. Happy to answer those here. All right, I'm going to give folks a few more minutes because sometimes it can take a minute to work up that courage or to kind of get your thoughts gathered. All right, Dawn is asking, once a telehealth program is established, how does the library know about the appointments? That is a really great question. And that is something that the people who are funded through this opportunity are going to help us figure out. We do have a little bit of history and data that we learned from the 2 libraries in Clearwater County. And so there's a variety of different ways to look at this. As telehealth develops as a field, there may be better resources to connect providers with scheduling services at the library. But right now, and Stephanie, correct me if I'm wrong, but right now this is one of the challenges. It kind of it relies on the patient scheduling with the library, which is a little bit complicated. So one of the things that we're hoping will come out of this particular pilot project is that some of these our funded libraries might help us solve this question. Whether that's third-party software that allows the provider and the patients to to schedule it together, possibly one of the things you could have is a public calendar where the provider and the patient can be looking at that public calendar together when they're deciding on, when to schedule their next appointment, and can schedule it in real time. Certainly open to a lot of suggestions or ideas as part of this project. All right. Lori asked, would we need an established partnership with a healthcare provider? It doesn't hurt, but it's not a requirement. I think that part of our job here at the ICFL and part of our job as a cohort is to help figure out how to establish those relationships. The Blue Cross Foundation is really willing to jump in and help navigate some of that. And it'll really depend on what type of service you're looking at. I mean, if you're really focused on mental health, we can help facilitate conversations with the Behavioral Health Network and help make those connections for you. We definitely anticipate that the ICF will play a very supportive role in helping you get these things figured out, but we're all going to be learning it together. Is telehealth, so I'm not sure who asked this, as it looks like it's an acronym, but they're asking, is telehealth only for people with insurance to connect with doctors, or can anyone use it? Well, I would like to think that anyone could use it. I mean, from the library's perspective, I don't see any reason why the library would need to put any kind of restrictions around who's allowed to use the telehealth facilities to, interact with telehealth services. So that question of insurance is really one that happens between the provider and the patient. Whether the provider can meet with the patient if they don't have insurance, and that's kind of up to, that's sort of out of our hands, but nothing in this grant or in our expectations that would say the library has to worry about that. Rebecca is asking, one model uses LibCal, other models have navigators funded through, oh, that's not a question, that's just a comment. Okay, thanks for that information. Posting some information about what's going on in Delaware, which is great. They're kind of on the vanguard, have a lot of exciting stuff going on there as well. And we'll definitely be sort of gathering these resources for the grantees who are selected, and definitely spending some time with selected grantees going through resources and kind of discussing options that they might have for moving forward. A lot of great stuff. I appreciate everybody sharing in the chat there.
Amelia?
Yes.
Hi.
Hi.
I'm from Lewiston City Library. My camera's not working. I'm a grad student also working on a project that's theoretical in nature, but just to speak to what you had touched on a little bit earlier about need and who can access it, that's kind of part of the research that I've been doing. And what I found is that what telehealth is serving in public libraries are those that are the people that we're already serving, the underserved, the people who are not necessarily, don't have that health literacy, that is another prong of librarianship, aren't technically savvy, which is something that we also do, people who are homeless or experiencing homelessness, seniors who use who are moving toward telehealth. Anyway, those cohorts are the ones that are utilizing this service, and it just, and like you had said earlier, it just kind of matches, it intersects really nicely with what libraries do anyway.
Yeah, absolutely. Rebecca, as you're furthering your research, please feel free to reach out to us. We'd love to incorporate any of the research you're doing. No point in duplicating efforts there. So if you have information you'd like to share with us, we're always open to that. And I think Rebecca brought up a good point too, is that there are a lot of people who utilize telehealth services. And I want to clarify that one of the reasons that we're limiting the scope of this grant to rural and remote libraries is just because the pot of money is relatively small. And because that's where we see the highest need, just because there's a lack of healthcare services in these communities. As we expand these other funding opportunities, especially the $3.5 million in capital improvement grants, and Stephanie, please speak up if I'm wrong on this, but I anticipate that will be open to a much wider range of libraries to address a much wider range of needs. So just because you're not able to do it this time around because you don't serve a rural community, keep developing those projects, because that upcoming funding is definitely going to be something you'll want to take a look at. And I also want to clarify that if you're a branch system and your main branch is located in an urban location, but you have a branch that serves a qualifying community, we would consider an application that specifically covered services at that qualifying branch. And Stephanie was just letting us all know that Orofino's director will be talking about their experiences at the Digital Inclusion Summit. So if you have not registered for the Digital Inclusion Summit, please do. It's going to be awesome. And it will overlap very nicely with a lot of what telehealth is going to be exploring in the upcoming year. Great questions, everyone. I'm glad to hear folks thinking through this. Any other questions that we can answer right now? And shoot, it does look like the recording somehow got paused when I took it off of the my screen share. I don't know why it kept doing that, but fortunately all of those questions were captured in the chat. I think Rebecca's the only one who had asked on voice, so I will be able to capture all of those questions and answers, and we can just post that as a document alongside the video. So those will definitely get captured. My apologies for the technical glitches. I'm not sure why that kept happening, but this is the world we live in. All right. Well, if anyone does have any other questions, feel free. I'm going to just type my email address directly into the chat so you can copy and paste it into your email. And my phone number as well. So please reach out to me if you have any follow-up questions. I am here to answer those. I don't mind doing it at all. I'm very excited about this project, and I'm excited to talk to all of you about it. So please do reach out. And with that, I am going to go ahead and end the meeting unless anyone has any burning questions at the last minute. Otherwise, I'll give you about 20 minutes of your day back. And I appreciate everybody for joining us today. Have a great Wednesday, everyone.